Hello everyone. So there are some next NCLEX practice questions we will discuss in this lecture. So let's start with our first question. Okay. So our first question is, the nurse is providing the education to a client who has recently received a diagnosis of tuberculosis on the importance of preventing the transmission of disease to their family members. To assess the client's understanding for the nurse's instructions, please select all the statements made by the client that demonstrate their comprehension to preventive measure of tuberculosis. So it is also a SATA based question. So basically, firstly, we will recognize and analyze the cues. So here, let's focus on the question. So question is asking for, we have to assess the client understanding of the nurse's instruction. Okay. So let's see the options. First is, I can use the regular plate and utensils whenever I eat. I am aware of the significance of completing the full course of medication. I know to cover my mouth and nose with tissue or elbow when sneezing. There is no need for me to isolate myself from my family members. I acknowledge the importance of wearing a face mask in public to prevent transmission. I understand that avoiding crowded places and close contact with others is necessary, and I'll dispose of my old clothing when I return to home to prevent spreading of the disease. So let's have an introduction of the introduction of the tuberculosis. Like, what is tuberculosis? What are the spreading measure of the tuberculosis? Okay. So all we know, the tuberculosis. What is tuberculosis? It is also known as our Koch disease, or white plague, or the Gons disease. Okay. So these are the other name of the disease, and basically Mycobacterium tuberculi is the main causative agent of the tuberculosis. And the main route of the spreading of the tuberculosis is like the air, so sneezing, coughing, talking. Okay. But some important things, the tuberculosis is not spread by some mayors. Like, what are the mayor that the tuberculosis is spread? So I have explained you, the primary mode of the transmission of the tuberculosis is through the air routes, through the droplet, like the sneezing, coughing, talking. Okay. And it is not spread by the some physical or the direct contact. Okay. Like you're shaking hands, kissing, or engaging in a sexual activity. So tuberculosis not spread, but it basically spread through the airborne routes or the droplets route, like the sneezing, coughing, and talking. So basically, the client have to prevent against the airborne preventions. Okay, client have to use the airborne preventions. So RN should educate the client according to the client's situations or their etiological factors, like to use the mask. Okay, use mask, or whenever he will cough or sneeze, he will use of the elbow to prevent the spread of the Mycobacterium tuberculi into the air, that other person can't inhale that. And while talking, he or she should cover the mouth, etc. So these all are the some basic introduction, like tuberculosis. It's also known as the Koch disease, white plague, Gons disease, and it basically spread by or basically caused by the Mycobacterium tuberculi, and the primary mode of the transmission of the tuberculi is air routes like sneezing, coughing, talking, etc. And tuberculosis is not spread by the direct contact. And in the direct contact, such as things like the shaking hands or engaging in a sexual activity, kissing, etc. So direct contact not as the primary mode of the spreading of the tuberculosis. So what kind of instruction RN should educate the client to prevent the tuberculosis, like use of mask, okay, like use of elbow during coughing, sneezing, okay, etc., to prevent the primary mode of the transmission of the tuberculi. And next here, the home isolation is necessary. Okay, so home isolation is very much necessary for the individual with the contagious disease like our tuberculosis, because it depend upon the some specific circumstances, and in the isolation condition can able to prevent the transmission of the tuberculosis. So here other some like crowded area. Crowded area should be avoided because patients can reduce the likelihood of transmitting the bacteria to help prevent the further spread of the disease. So tuberculosis patients should avoid the entering in the crowded areas, like, okay. And again, here the some measures, like the tuberculosis patient can use the utensils, okay, clothing, etc. So it is not the main measure to prevent the spread of the tuberculosis, okay. So next, come to the right answer. Okay. So here, let's come to the question back. My question was like, according to the client's understanding regarding the tuberculosis. So here, see all the options. So first option is also the right answer. I can use the regular plates and utensils whenever I eat. So as I have explained you, like tuberculosis is not transmitted to sharing glasses, plates, utensils, clothing, sheets, furniture, toilets, okay. Main route of the tuberculosis transmission is only and only the air. So it is also a right answer. B, I am aware of significance of completing the full course of the medication. Yes. So medication, as we know, the treatment of tuberculosis is based on the DOTS therapy, like direct observed treatment short course, in which individual have to complete the course. So whenever the client state that I am aware of the significance of completing the full course of medication, it means he or she has received exactly the right information of the from the RN. Okay, so the option is also right. C, I know to cover my mouth and nose with a tissue or my elbow when sneezing. So also I have explained earlier that a client can use the elbow or cover the mouth or the nose by any tissue paper or mask to prevent the primary transmission of the tuberculosis. So it will also the right information, understanding of the information by the client, that I know to cover my mouth and nose, because this activity can able to like help to prevent transmission. As I have explained you, that main route of the transmission of the tuberculosis is from the air. So when the droplets of the the Mycobacterium tuberculi in the droplets of the client sneezing, coughing, so it can be prevented with the help of the use of the elbow or covering the mouth. Next option D, I will use a I will use a paper tissue to cover my mouth and nose when coughing and dispose them properly. This is also the right information by the client understanding from the RN, because as I have explained you that the air droplets is the main route of the transmission of the tuberculosis. So if he or she will dispose them properly, that it can help to prevent the transmission. Next option is the wrong, like there is no need to for me to isolate myself from the family member. So isolation is also a necessary measure for the individual suffering from the tuberculosis. So here when the client state that there is no need to isolate, it means he or she hasn't received the proper information, or he or she hasn't a proper understanding regarding the nurse's instructions. So E will be not the right answer. Next option, I acknowledge the importance of wearing face masks in the public to prevent transmission. This is also the right answer, because when patient is suffering from the contagious diseases like tuberculosis, COVID, so all these based on the preventions by using the face mask. So face mask is very important to prevent the airdrop infections. So here option is the right. And G, I understand that avoiding crowded places and close contact is necessary. So it is also the right answer, because by avoiding the crowded areas and the close contact, tuberculosis patient can reduce the transmission of the bacteria. So patients suffering from tuberculosis must avoid the crowded places. Next option, I will dispose my old clothing when I return to the home. So it is not the right option. Okay. It is not the right option, because as we know that the old clothing, it is not a measure that spread the tuberculosis by using the clothing, etc. Okay. So here, these are the right options: A, B, C, D, F, and G. Hope to understand this question. Let's move towards the next question. When admitting a client with hypoglycemia, the nurse should be vigilant in the identifying the sign and symptom associated with this condition. And hypoglycemia occur when blood glucose level drops below than the normal levels, and typically below the 70 mg per dl. The nurse should expect the following sign and symptom in a client with hypoglycemia. SATA. Okay, so it is also a SATA based question. So let's recognize and analyze the cues. It is the condition of the hypoglycemia in the question. And basically the focus is on enlisting about the sign and symptoms of the hypoglycemia. So SATA based question options are frequent urination, itchy skin, slurred speech, hyperventilation, diaphoresis, palpitation, and thirst. So mainly the condition given is hypoglycemia. And we have to find out the sign and symptom specifically when the blood glucose level is less than 70 mg per dl. Okay. So let's have a flashback on hypoglycemia. Okay. So as we know, the hypoglycemia is a condition in which blood glucose level is less than its normal range. And specifically when blood glucose level is less than 70 mg per deciliter. So this is a hypoglycemic condition. So here, there are some main important sign and symptom when patient is suffering from the hypoglycemia. So two conditions, first is the hypoglycemia, second is the hyperglycemia. So what kind of symptoms we will see in the hypoglycemia, like hunger, irritability, trouble, concentration, trouble in concentrating, or we can say that our level of consciousness, fatigue, sweating, confusion, fast heartbeat, shaking hand, and headache. And in hyperglycemia, there are the extreme thirst like dry mouth, weakness, headache, frequent urination, blurry vision, nausea, confusion, shortness of breath, etc. So now we will focus on these sign and symptom. So see here, like some other symptoms: shaky hands, sweating, palpitation, nervous system affectance, tingling, hungry, weakness, vision changes, irritability, difficulty speaking, headache, personality changes, coma, and the seizures. Okay. So first main symptom of the patient suffering from hypoglycemia is palpitations. So now we will able to understand like how the palpitations occur. So when there is decreased blood glucose level, okay, that lead to secretion of epinephrine and norepinephrine. Okay, that lead to, and it is due to the activation of our sympathetic nervous system. So when the blood glucose level falls, so here body stress response activate, body stress response activates, that lead to increase heart rate and palpitations. Okay, so that's why the main first symptom after the hypoglycemia, that is palpitations. So it is due to when the decreased blood glucose level lead to the secretion of the epinephrine and the non-epinephrine, and that help to generate the body stress response. And when the body stress response occur, there will lead to some our body changes, some cardiovascular changes like increased heart rate and palpitations. So it is the first one. Second symptom that is main in the hypoglycemia, that is diaphoresis. Diaphoresis. It means excessive sweating. You can see here sweating. So how this occur? It is also associated with the hypoglycemia due to the because when the blood glucose level is decreased, blood glucose level, that lead to again sympathetic nervous system response triggered, and that lead to secretion of epinephrine and norepinephrine, that lead to diaphoretic condition. So that's why to overcome the blood glucose level in the body, so body stress response will occur, that is the diaphoresis. Next here, third main symptom is that slurred speech. So how this slurred speech occur in the hypoglycemia? So as you will see, like decrease blood glucose level lead to suppression of our central nervous system, that lead to altered level of consciousness and our altered speech, disorientation. All these happen due to the suppression of the central nervous system, and that lead to slurred speech. Okay, so these three main symptoms I have explained you. So right answer will be slurred speech due to the suppression of central nervous system, diaphoresis and palpitation due to the epinephrine and norepinephrine release and the body's response, stress response, sorry. So these three options will be the right answer: slurred speech, diaphoresis, and palpitation. Hyperventilation is not associated with the hypoglycemia, because it is a condition of the hyperglycemia due to the acid production. So it is not related to like this condition. And also frequent urination. So frequent urination is a condition of the polyuria, and polyuria seen in hyperglycemia. Okay, I have explained you. Itchy skin also not the component of this, because all these are the typical, not the typical symptom of the hypoglycemia. So itchy skin, frequent urination will not answer. Hyperventilation is not associated with the hypoglycemia, because here the acid or the ketone production, and that is the feature of hyperglycemia, and thirst also the symptom of the hypoglycemia. Sorry, hyperglycemia. Okay. So polyuria, polyphagia, polypepsia, all these symptoms are of the hyperglycemia. And here the three main options I have explained you. The right answer, slurred speech, diaphoresis, and palpitations will be the right answer. Next, move to our next question. What are the common clinical manifestation or the signs that a nurse or the RN caring for a client with diabetic ketoacidosis should expect to observe? Select all that apply. So it is also a SATA-based question. So let's have to find and recognize the cues asking for the common clinical manifestations and client having the diabetic ketoacidosis. Okay. So condition given is diabetic ketoacidosis. Okay. And diabetic ketoacidosis, and RN have to observe the common sign and symptoms of the diabetic ketoacidosis. So option given: acetone breath, dehydration, elevated sodium bicarbonate, low partial carbon dioxide, retinopathy, and sweating. So here, firstly, we will discuss about the diabetic ketoacidosis. So we know the diabetic ketoacidosis is a serious complication of the diabetes mellitus, and the condition develops when the body can't produce enough insulin. Insulin play also a key role in helping the sugar, a major source of energy for the muscles and other tissues. And without enough insulin, the body began to break down fat as the fuel, and this causes a buildup of the acids in the bloodstream called the ketones. And if it left untreated, this can be lead up to the diabetic ketoacidosis. So here, diabetic ketoacidosis is a serious complication of the diabetes. And what is diabetes? When it is a condition when insufficient insulin is produced. Okay. So firstly, diabetes mellitus is a condition in which insufficient insulin is produced, and due to there is condition increased blood glucose level in the body. So when diabetes is not treated, it leads to the diabetic ketoacidosis. And what is the diabetic ketoacidosis? So without enough insulin, fat will be excessive fat breakdown that lead to excessive ketones production. Excessive ketone production lead to the acidosis. Hence, it is a condition of the metabolic acidosis. Okay. So this is whole the explanation about the diabetic ketoacidosis. So diabetic ketoacidosis is a serious complication of the diabetes, and when the insulin is not enoughly produced, then the fat will be excessively break down to maintain the body energy that lead to excessive ketone production. And when there is excessive ketone production, there is a condition developed called as acidosis, and a condition here the called the metabolic acidosis, that is the acid base balance disorder of the bicarbonate or the metabolic indicator here. So this is all about the diabetic ketoacidosis. Next we will discuss about the main symptoms. So we know, like when there is the diabetic ketoacidosis condition, so there is a feature occurs, that is the acetone breath. So see here, first feature of the diabetic ketoacidosis is the acetone breath. So how this occurred, the acetone breath? So see, due to excessive ketones production, that lead to cause a fruity scanty odor of breath, which is called as acetone breath. Acetone breath or the fall breath we can also called. So how this occur? Because there is excessive ketone body production. So excessive ketone production can lead to a fruity odor of our breath, and that is called the acetone breath. It is the first feature. Second is, here you can see the diagram, and it is a diagram of retinopathy. Okay. So see here about the retinopathy. So firstly, what is retinopathy? Retinopathy is a microvascular disorder. Okay. And it can occur due to the long-term effect of diabetes mellitus. So what condition in the retinopathy? It can lead to loss of vision, etc., or the blurring of the vision, etc. So when diabetes mellitus will left untreated, it can directly damage our retina. So when there is a damage of the retina, there will be patient unable to see due to the loss of vision, because retina is that part of the inner part of the eye in which image is formed directly, and when the image is formed, only can patient can able to see. So here retinopathy is the serious complication of the diabetic mellitus that can lead to the condition long-term effect of the diabetes. So second condition is diabetic retinopathy, and how we can diagnose the patient from the diabetic retinopathy, because when patient complains about the blurring of the vision or not able to see properly. So these all are the symptoms of the diabetic ketoacidosis. Next is about the main feature of the diabetic ketoacidosis is small breathing. This is the main important feature of the metabolic acidosis when there is patient suffering from the diabetic ketoacidosis. So you can here see how this occur. Because metabolic acidosis triggers are respiratory compensation in form of small breathing. And what is small breathing? You can see here. Rapid breathing, irregular, rapid breathing. So you can see here the small breathing. How can it occur in the ketone, diabetic ketoacidosis, uremia, sepsis, salicylates, methanol, aldehyde, lactic acid, or the lactic acidosis? So these are the some important conditions in which small breathing will seen. So main feature of the diabetic ketoacidosis is the small breathing. So how this occur? Because the metabolic acidosis trigger our respiratory compensation. So our lungs able to compensate or to maintain the condition. So there will be seen the irregular and the rapid breathing pattern of the client. And this can also, here I want to explain you. You can see here, these are the lungs. Sorry. So we can see in our lungs condition, here's the carbon dioxide, partial carbon dioxide. So when the patient is irregularly breathe and rapid breathe, the more and more carbon dioxide will out from the lungs. So here always the partial carbon dioxide level will be low. So these all are the features of diabetic ketoacidosis. So let's move to the right options. So we have discussed some clinical manifestations. Okay, clinical manifestations of the diabetic ketoacidosis. So right options will be are acetone breath, low partial carbon dioxide, and the retinopathy. So you know acetone breath due to the excessive acid production or excessive ketone body production that will lead to the our breath order like acetone breath or fruity odor. Second is low partial carbon dioxide. So how the low partial carbon dioxide? Because decreased partial carbon dioxide result from the rapid breathing. I have explained you. Rapid or irregular breath, then our lungs try to compensate the condition and our partial carbon dioxide level will be fall down. Retinopathy, I have explained you. It is due to the long-term effect of the diabetes mellitus or the insufficient insulin production in the body. So that is why these are the main symptoms. And sweating. So sweating is the main feature of, I have explained you, hypoglycemia rather than the hyperglycemia. Okay. And I have explained you, but when like the previous question that how the sweating occur due to the sympathetic nervous system activation. So this will not the right answer. Elevated serum bicarbonate. Okay. So elevated serum bicarbonate is not the right option here because elevated serum levels seen in your metabolic alkalosis condition. So diabetic ketoacidosis is a condition of the metabolic acidosis in which more and more acid production. So pH will decrease because acidic condition, and bicarbonate will also decrease. Okay. Because diabetic ketoacidosis is a condition of metabolic acidosis, and in metabolic acidosis, pH is always directly proportional to the bicarbonate. So if pH decrease, bicarbonate will also decrease. So elevated serum bicarbonate is not the option because there will be decline in the serum bicarbonate. And dehydration is also not the feature of the diabetic ketoacidosis because dehydration is a condition related to our hypoglycemia. So there are the three main right answers: acetone breath, low partial carbon dioxide, and the retinopathy. Let's move to our next question. When caring for a client who has been diagnosed with the heart failure, which nursing diagnosis would be appropriate? Please select all that applicable. So means recognize the cue here, heart failure condition given, and we have to select nursing diagnosis according to the priority. So here, ineffective tissue perfusion related to decreased peripheral blood flow, secondary to decreased cardiac output. Option number B, increased cardiac output related to structural and functional changes of the heart. C, activity intolerance related to decreased cardiac output and impaired oxygen delivery. Impaired gas exchange related to pulmonary congestion and impaired oxygenation. And impaired gas exchange related to decreased sympathetic nervous system activity. So firstly, we will discuss about the condition heart failure. Okay. So heart failure, you can see here, heart failure occur due to the structural and functional abnormality of the heart tissue and the muscles. It can result from changing in the systolic and diastolic functions of the left ventricle. And basically, heart failure or the congestive heart failure is a condition when heart unable to pump blood according to bodily demand okay. So hope so you're able to understand about the heart failure. So it is the condition in which heart is unable to pump blood according to bodily demand because or like the due to the structural and the functional abnormality of the heart tissues and the muscles. And it can be result from changing in systolic and diastolic functions of the left ventricles like vasoconstriction, fluid retention, edema, etc. Okay. And most common cause of the heart failure is decrease ejection fraction. Understand? Or we can say that when ejection fraction less than 40, then condition develop the heart failure. So let's come to the diagnose. Okay. Our first diagnose according to the priority will be ineffective tissue perfusion related to decreased peripheral blood flow secondary to the decreased cardiac output. So how it will? So we can see here like I have explained you. See here. Weakening, a weakness of heart muscles that can lead to inadequate pumping of blood because heart muscles are weak that lead to blood pulling in left ventricle that can lead to there is large amount of blood in left ventricle that lead to reduced cardiac output. And when there is a large amount of the blood here, So it can lead to some complication like the clot formation. And if there is a clot formation, that lead to impair tissue perfusion, because blood will not reach to all organs, reach to tissues and organs. Okay. So understand the first diagnose, like there will be the weakening of the heart muscles, and when heart muscle will weak, there is inadequate pumping of the blood. So the blood will pool out in the left ventricle, and when there is a large amount of blood remains in the left ventricle, it will reduce the cardiac output. And due to the large amount of blood, there will be a clot formation or the thrombus formation. It can be the complication. And if there is a clot formation, you can see here, like here the clot formation in the any artery. So blood will not able to reach to all the organs or the tissues, and that can lead to the ineffective tissue perfusion. So this is our first diagnosis. Secondly, we can see okay, so you can see here, as I've explained you, if there will be less than 40% ejection fraction, there will be a condition, heart failure. So it will lead to poor intolerance, and that can lead to so how the poor intolerance? Due to the decreased cardiac output. And when the cardiac output will decrease, body will not able to tolerate the conditions, and that can be able to, like the poor O2 supply to our tissues and organs. Tissues and organs. Understand? Okay. So let's come to the right answers. So our first answer option is right. The ineffective tissue perfusion, because oxygen or the blood supply will not reach to the organ and the tissues. So here, tissue perfusion, ineffective tissue perfusion related to decreased peripheral blood flow secondary to the decreased cardiac output. This will be the right answer. Second option is not right, because there is an increased cardiac output. So in heart failure, cardiac output will not increase. There will be decreased cardiac output. Next is inactivity tolerance related to decreased cardiac output and impaired O2 delivery. So it is also the right option, because when there is ejection fraction less than 40%, so there will be decreased cardiac output and poor oxygen supply to the tissues, and the patient will not able to tolerate or not able to do the daily physical activities. So there will be the priority diagnosis activity intolerance related to decreased cardiac output and impaired oxygen delivery. Next option is also right here, the impaired gas exchange related to pulmonary congestion. So in starting of the heart failure introduction, I have explained you that there will be vasoconstriction, edema, and the fluid retention. So when there is excessive fluid that will retain in the lungs, that will lead to the pulmonary edema and the pulmonary congestion. So here, impaired oxygenation will be there when there is a fluid retain or the pulmonary congestions occur in the lungs. So there will be affecting that the impaired gas exchange. So our A, C, and D options are the right options. And the impaired gas exchange related to decreased sympathetic nervous system. So this is an increase in the, not here decrease. It is due to the increased sympathetic nervous system. So E option will not right. So hope so you understand all the options, like why the A, C, and D options are right. A option is right because there will be decreased peripheral blood flow and decreased cardiac output. There will be altered tissue perfusion. C option is right because when the ejection fraction is less than 40%, that will lead to decreased cardiac output and impair oxygen delivery, and patient will not able to do the daily physical activity. So here activity intolerance seen. And D option is right, where impaired gas exchange related to, because there is excessive fluid retention in the heart failure, specifically in the left side heart failure. So there will be the pulmonary congestion occur, and when there will be the pulmonary congestion occur, fluid will retain, pulmonary edema will occur and interrupt our oxygen supply to the body, and here the impaired gas exchange. And B and E are not the right answer because here increase, so not increase cardiac output, there will always decrease cardiac output in the heart failure, and impair gas exchange related to decreased sympathetic. So sympathetic nervous system activity will not decrease here, it will be always increase. So our next question, when providing care for a client with a central venous line during the chemotherapy administration, which of the following action should be included in the plan of care? Please select all that apply. So let's focus on the question here. Central venous line. Okay, here RN is providing care, patient having the central venous line during the chemotherapy. Okay, so what kind of nursing action a RN should take or perform? So SATA, it is also a SATA based question. So options are: verify the patency of the line, assessing for the returning or regular interval, monitor the insertion site for the signs of swelling, redness, and drainage, administer cytotoxic medication even if the blood is returned or the absent. If unable to blood draw, reposition the client to encourage the cuffing, consult the healthcare provider to confirm the placement of central venous line, implementation of sterile techniques during the line assist, and medication administration is not necessary. And if it's uncertain about the line placement, evaluate through the X-ray. So let's have an overview about the central venous line. So you can see here the central venous line or the central venous catheter. Sorry. Okay. So central venous catheter is a special IV line that is inserted into a large vein in the body. Several veins are used for the central venous catheter, including those located in the shoulder subclavian vein, neck jugular vein, and groin femoral vein. So firstly, you have to introduce about the central venous line. So you can see here the diagram of the central venous line. So it is a special IV lining when we have to administer the large amount of the medication in case of the chemotherapy, etc. And it always inserted in the large vein of the body. Okay, so the main veins in which the central venous catheter or is inserted, that is our subclavian vein. Here you can see that the shoulder vein, subclavian vein, neck vein, jugular vein, okay, and groin femoral vein. So this is the introduction of the central venous line, and there are some points regarding the central venous pressure. So normal pressure is always 3 to 8 mm of Hg, okay, CVP. So this is the normal range of our central venous pressure. And here you can see insertion. So exit site out of the skin, catheter tail, cap. This means it got some parts of the central venous catheter you can see here. So next. So you can see here, a major concern when administering the cytotoxic intravenously is the possibility of the vessel irritation or extravasation. So as I have explained in my lecture, that is fluid and electrolyte imbalance or the IV therapy, extravasations, or it is also condition infiltration. So it is a complication of the IV therapy in which fluid out from vein. In which fluid enter out from the vein. Okay, so you can see here, this is like the hand, and here the vein, but fluid will not enter through the vein. It start able to depositing into the surrounding area. So this is the extravasation condition or also the infiltration. So there are the some common steps or the responsibilities that RN must be in her mind when assessing the central venous line or the central venous catheter in the individual. So let's come. Okay. So you can see condition here. It is the condition we call the chemotherapy. Extravasation. So you can see here the redness swelling here. So we can also called it as with the correlating some symptoms like burning, pain, swelling at the infusion site. So this is the main complication. So RN must have checked time to time this IV sites. Second, any kind of the tubings or the lines when we insert, for the confirmation we always do the X-ray, because X-ray is the confirmatory procedure. X-ray is a confirmatory procedure through which we can confirm the line placement. As you can see here, either is a CVP line or it's NG line, okay, NG feeding tube, sorry. So any kind of tubing or line when we insert, we can confirm it only and only with the X-ray. And next here, so you can see here this man. So RN will drawing back the blood from the CVP line to ensure that the line is correct placement, or can be able to infuse the medication, cytotoxic medication. So always, and if she will not able to draw the blood in the back in the CVP line, always reposition the client. Okay. So let's come to the right options. So first is verify the pregnancy of line assessing by the blood return at the regular interval. So it is exactly the right option, because when we assess the line for blood return at the regular interval, it means the patency of line is good. So A option is right. We monitor the insertion site for the swelling, redness or the drainage. So as I explained you with the help of the diagram. So always check the insertion site for any kind of swelling, redness, in drainage, inflammation and the extravasations. Here, right option. So C, so next option D, sorry. If unable to withdraw blood, so I have explained you, when we not able to withdraw the blood from the CVP line, always reposition the client and encourage cuffing. This will help to maintain the normal central venous pressure of the client and able to draw the blood. Next E, consult the healthcare provider to confirm the placement of the central line if any concern. So you can see here, if there is any concern, any type of concern, you will able to see. So always consult the healthcare provider to confirm the placement of the line. And how we can confirm? With the X-ray. Okay, so you can see here, if there is uncertainty about the line placement, through evaluation using the X-ray, because X-ray is the confirmatory procedure for assessing the tubing and the line insertion. So these all are the right answers. And F and C is not right answer, because the implementation of sterile technique during the line assessment medication are not needed. So it is always needed. So there will be always the sterile use of the sterile techniques and not needed. So patient can have a great infection already. His or her immunity will low, so not needed will not the right option here. And this is a cytotoxic medication if the blood return is absent. So this is always not the right answer. When the blood is not returning, so we have to reposition the client and encourage the cupping. And we cannot able to administer the cytotoxic medication if blood is not returning from that CVP line. So it will not the appropriate option here. So the right options are A, B, D, E, and G. Okay. So this is all about my today's question about the heart failure, diabetic ketoacidosis, hypoglycemia, and CVP line and tuberculosis preventions. So this is all about my questions. Hope so you able to understand. If you have any doubt, you can consult. Thanks for listening me.